Legislators on Zoom, can you hear us okay?
Yes, I can.
Yes.
Yes, I can.
All right, we've got everyone. Go ahead.
All right. Good evening. The April 28th, 2026 meeting of the Human Service Committee will now come to order. Will the clerk please call the roll?
Mr. Blankley. Mr. Blankley. Oh, we cannot hear you.
Here.
There we go. We can hear you now. Ms. Bonnick.
Here.
Ms. Bonnick is present. Mr. Cruz.
Presente.
Mr. Cruz is present. Mr. Dondorfer. Mr. Dondorfer is present. Ms. Hasman.
Here.
Ms. Hasman is present. Mr. McCabe. We cannot hear you.
Here.
There we go. Mr. McCabe is present. Mr. Milne. Mr. Milne is present. Ms. Smith. Ms. Smith is present. Ms. Vasquez Simmons.
Here.
Ms. Vasquez Simmons is present. President Roman.
Here.
President Roman is present.
Is there anyone signed up for the public forum?
No, there's not.
Is there anyone present who has not signed up to speak, who would like to address the committee at this time? Okay. Since there are none. The next item on the agenda is the approval of minutes. You have the February 24th, 2026 minutes before you. They will stand approved unless the clerk is notified of any changes by the end of the day. The next item on the agenda is new business. Madam Clerk.
Referral 26-0110. Authorize a contract with Labella Associates DPC for professional design services for the Monroe Community Hospital Pediatric Unit Expansion Ventilator Unit Renovation Project.
Move it.
Second.
Moved by Legislator Cruz, second by Legislator Bonnick. Is there any discussions? All those in favor, please signify by saying aye.
Aye.
Any opposed?
Aye.
Item carries. Next item.
Referral 26-0111. Authorize a contract with URMC Labs, a division of the University of Rochester, for laboratory services at Monroe Community Hospital.
Move it.
Second.
Moved by Legislator Cruz, second by Legislator Bonnick. Is there any discussion?
Just got one question.
Madam Chair.
Okay, Legislator Cruz?
Through you, Madam Chair. How long have we had this contract with this entity?
Hi, Darren Bell from Monroe Community Hospital. Through the chair, I believe this has been in place since 1988.
Thank you. That'll be all.
Madam Chair,
Oh, yes, Legislator Hasman?
thank you. I'd just like to declare my interest.
Noted, thank you. Is there any other discussion? All those in favor, please signify by saying aye.
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 Any opposed? Item carries. Next item.
Referral 26-0112. Acceptance of a grant from Health Research, Inc. for the Expanded Partner Services Initiative.
Move it.
Second.
Moved by Legislator Cruz, second by Legislator Bonnick. Is there any discussion?
Yes, I have a question.
Legislator Bonnick?
To the admin through you, Madam Chair. Can we get some information regarding patient outcomes from this grant, please?
Through the chair, I'm sorry, could you repeat the question?
Patient outcomes. Can we get some information on patient outcomes?
Through the chair, yes, absolutely, we can get you that information.
Are there any other discussions? All those in favor, please signify by saying aye.
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 Any opposed? Item carries. Next item.
Referral 26-0113, acceptance of a grant from the New York State Department of Health for support of the Monroe County Nurse Family Partnership Program.
Move it.
Second.
Moved by legislator Cruz, second by legislator Bonnet. Is there any discussion? All those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 26-0114, authorize a contract with Ontario Bus, Inc. for bus transportation services for Monroe County early intervention and preschool special education programs.
Move it.
Second.
Moved by legislator Cruz, second by legislator Bonnet. Is there any discussion? Legislator Dondo.
Thank you, Madam Chair. Through you to the administration. Will these buses convert to all electric buses in the future due to the state mandates?
Through the chair, if the mandate stands, then yes, they would need to do that.
Thank you. Through the chair to the administration, can you provide us with the most current wait list for EI services, including zip codes?
Yes, I can.
Thank you. Through the chair to the administration, can you provide us with the usage of these transportation services by zip code?
Through the chair, I can tell you right now that there are approximately 700 children this school year using the bus transportation services. I can see if I can get that by zip code, yes.
Okay, thank you. And through the chair to the administration, why is this contract increased by $5 million each year? The costs have grown significantly. Have the costs grown significantly in recent years? Have there been more routes added to justify this increase?
Through the chair, it's been a combination of price increases and routes being added to keep up with the demand.
Thank you. I yield the floor.
Right. Is there any other discussion? There being none, all those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 26-0115, amend Resolution 382 of 2018 as amended by Resolutions 83 and 148 of 2024 and Resolution 221 of 2025 to accept additional funding from the New York State Department of Health and extend the time period for the STD testing and safety net populations program.
Move it.
Second.
Moved by legislator Cruz, second by legislator Bonnet. Is there any discussion? There being none, all those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 26-0116, amend Resolution 427 of 2025 to authorize a contract with Coordinated Care Services, Inc. for aging planning and program services in 2026 through 2027.
Move it.
Second.
Moved by legislator Cruz, second by legislator Bonnet. Is there any discussion? There being none, all those in favor, please signify by saying aye.
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 Any opposed? Item carries. Next item.
Referral 26-0117, acceptance of a grant from the New York State Office of Children and Family Services for the Family First Mobile Response Program.
Move it.
Second.
Moved by legislator Cruz, second by legislator Bonnet. Is there any discussion? Legislator Cruz, my apologies.
Thank you, Madam Chair. Through you, Madam Chair, to the administration, do we have a rough number about how many families they serve or work with?
Through the chair, last year we served 60 families.
60?
Yes.
Do we have a through you, Madam Chair, to the administration and number of how much that might have been? That's, was it 3 people per family, 4 people per family? On average?
Through the chair, I'm not sure I understand the question.
How do we quantify families? Is it 4 per family, 5 per family? How many individuals per family? I'm trying to get a total number of people served, not families.
It may or may not be about the same number. The mobile response program, through the chair, responds to after-hours crisis calls from kin caretakers and foster parents in an effort to stabilize a child's out-of-home placement so that we avoid a change in placement, a trip to the hospital as part of a mental hygiene transport, or a transition to a higher level of care.
Thank you. No further question.
Is there any other further discussion? Okay, there being none, all those in favor, please signify by saying aye.
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 Any opposed? Item carries. Next item.
Referral 26-0118, acceptance of funding from the New York State Office of Temporary and Disability Assistance for the Shelter Arrears Eviction Forestallment Program.
Move it.
Second.
Moved by legislator Cruz, second by legislator Bonnet. Is there any discussion?
Yes, I have a couple of questions here.
Legislator,
Obviously,
legislator.
yes, ma'am.
I'm sorry, we just can't hear you.
Oh, okay. Through you to the administration. Obviously, this program look like it's a program that could be impactful to the families who are in need. So how would someone go about applying for this type of a program?
Hello. Good evening, Denise Reed from Monroe County DSS. Through the chair, for the SAFE program, an individual cannot apply directly. The department is required to accept applications for other emergency assistance rental programs, including emergency aid to families, emergency safety net assistance, and emergency aid to adults. If an individual is ineligible for one of those 3 emergency assistance programs, then we automatically determine the eligibility through the SAFE program. Through the chair.
Okay. What is the turnaround time once someone is deemed eligible? What's the turnaround time for them to receive this money?
Through the chair, it's hard to say. I could get the data. I don't have it with me today, so we do have it. But generally, there's already been a determination because they're first applying for one of the primary programs. So that's usually a 3 to 4 week process. And then once they provide the documentation for that, if we determine they're ineligible for those, and then we move to SAFE, it could be additional information that's requested. Not usually, because we usually have everything. So it's a pretty fast, safe determination if we have denied them for one of the other programs. But it really depends on how much additional information we need to make that secondary determination. So most of these cases are currently happening in the Eviction Diversion Resource Center, which is down in the Hall of Justice. So we usually are trying to make quick work of it to preserve the tenancy and prevent the eviction. So it could take 4 to 6 weeks total for the process. Through the chair.
Okay. And is this a set standard amount, or is this allocation based on need?
Through the chair, the allocation from the state, which is what we're accepting today, asking to accept today, is a set allocation from the state. We had an allocation last year, an allocation this year that was estimated based on what the state gave us last year. But when we received the official notice from the state, it had a little bit more. So that's why this is a small amount. I think it's $2 million total. $2.1 million total from the state as the allocation. As far as allowances to the tenant who's applying, that does vary. So it's based on how much they owe, how many months that we can pay back, how much the landlord's willing to accept to forestall the eviction. So that amount varies. On average, it's a little over $4,000 per household right now that we're issuing through the chair.
Okay. And do you have any idea how many people has been served by this program so far?
Through the chair, for the total allocation, which actually goes back to last year, I think we're at, we just did these numbers for Judge Barrett at the court. I think about 400 households have been helped so far through this program, and we have just under 100 people currently pending through the chair.
Okay. Well, do you find that property owners, landlords, or recipient are, what's the word I'm looking for? A recipient of this program, they are on board with this program when you have interacted with them?
Through the chair, yes. But I will say that sometimes we cannot prevent the eviction. A part of what we can't pay with this money is late fees, other court fees. So if a landlord's willing to accept, they usually have to forego some of those other fees. But for the most part, landlords are receptive, and we are serving hundreds of people with the funding through the chair.
Okay, yeah, thank you, receptive. That's what I was looking for. So thank you, Denise, for that information. I yield.
Is there any other discussion? Legislator Cruz.
Through you, Madam Chair, to the administration, I believe I heard that there was 3 distinct categories from which funding could be utilized, or this funding could be utilized for. Can you repeat what those were again?
Through the chair, there's actually 3 distinct funding models or funding sources that you have to exhaust first before you can use this funding. So those 3 are emergency aid to families, emergency safety net assistance, and emergency aid to adults. So a person cannot apply directly for SAFE. The regulations are very specific. We first have to determine the eligibility on one of those 3 programs, and only if the person is not eligible for one of those 3 programs do they move to being considered for the SAFE program. Through the chair.
Okay, thank you. That clarifies my other questions. Thank you.
I
Yield.
have one more question.
Hey, Legislator Bonnet.
Through you, Madam Chair, to the administration. I see here where this funding covers both rent and mortgage arrears. Is there a different set of engagement when it comes to funding rent versus mortgage arrears?
Through the chair, no, we don't see very many people applying for mortgage arrears assistance, but the same 3 emergency assistance programs could also assist with mortgage arrears, and we would do the same process of evaluating for SAFE after one of those, after they've been denied for one of those 3 programs. Through the chair.
Okay. Thank you. I yield.
Is there any other discussions? I do actually have a question, and this is to the administration. The question was, maybe I didn't get a clear answer, or right. How does someone actually go applying for this? You mentioned that the safety program, they're not able to apply for this directly, but the other 3, how would they go about applying for it?
Madam Chair, so they cannot apply directly, right? There is no application process for SAFE. The department is required to evaluate them for SAFE after they apply for one of the other 3 programs. So internally, our financial assistance division has a process where if a person comes to our offices to apply, or to the court to apply for emergency rental assistance, we first evaluate them for one of the 3 programs. So they're filling out a public assistance application. They're going through that emergency assistance process. If they're determined ineligible, then we automatically have to evaluate them for the SAFE program. They cannot come in and say, I want to apply for SAFE. Some people do, and we say, you have to apply for emergency assistance first. And so we go through that application process with them. Because that is not an allocation. Those are public assistance benefits. And so we want to use those funds first. The SAFE allocation is a specific amount. And so we're trying to use funding from those other programs first. And that is how the program is designed. That is not a local decision. That is in the regulation that you can only be evaluated for SAFE after you have been evaluated for one of the 3 emergency assistance programs. Madam Chair.
Okay, thank you. To the administration, you referenced Judge Barrett. At any point, can the judges refer a client to the SAFE program?
Through you, Madam Chair. So judges do refer people to the EDRC when our staff are there. They're not usually referring them to a specific program. I'm not sure if judges that are in housing court are fully aware of the SAFE program, but they do sometimes adjourn, is that what you're trying to say? Adjourn the eviction case to refer the person to EDRC. When they get to us though at the EDRC, we are determining what program they're eligible for. So whether they know about SAFE or not, we are evaluating them for one of those 3 primary programs first. And then if they're ineligible, determining them for a SAFE. So the judge could refer them, but we would still have to follow the regulations and do one of the other 3 programs first before we could evaluate for a SAFE through the chair.
Great, thank you. Is there any further discussion? There being none, all those in favor, please signify by saying aye.
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 Any opposed? Item carries. Next item.
Referral 26-0119, acceptance of a grant from the New York State Office of Mental Health for the PFC Dwyer Veteran Peer-to-Peer Support Group Program, authorizing interdepartment transfer, amend Resolution 109 of 2024, authorizing a contract with Compeer, Inc.
Move it.
Second.
Moved by Legislator Cruz, second by Legislator Bonnet. Is there any discussion? Okay, there being none, all those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 26-0121, acceptance of a grant from the New York State Department of Health for the HIV surveillance program.
Move it.
Second.
Moved by Legislator Cruz, second by Legislator Bonnet. Is there any discussion? There being none, all in favor, please signify by saying aye.
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 Any opposed? Item carries. Next item. You're on. Okay,
That's the last item.
are there any other matters to come before the committee? There being none. There being no other matters, the April 28th, 2026 meeting of the Human Service Committee stands adjourned. The next meeting of the Human Service Committee will be held on Tuesday, May 19th, 2026 at 5 p.m.